Hello, my name is Sanjay Kamsu and my today's topic is Nipah virus. So we can start from the introduction of Nipah virus. Nipah virus is a zoonotic virus which is transmitted from animals to humans. First, it is identified in Malaysia in 1998, and this virus is belonging from the Henipavirus genus. Family of this virus is Paramyxoviridae. It is highly pathogenic virus with a high mortality rate. High mortality rate, the range of the mortality rate is the 40 to 75%. Now we can see the mode of transmission of this virus. Contact with infected fruit bats or pigs. By this, the virus will spread from the animals to humans. Human to human transmission through the respiratory secretion. From the respiratory secretion, like the sneezing, coughing, from that type of symptoms, that this virus will transfer from human to human. Consumption of contaminated fruit and the raw palm sap. By eating these all things, this virus also may occur. Now we can see that how Nipah virus will affect in CNS and the neuromuscular system of the human beings. Nipah virus is a neurotropic, meaning it is strongly affinity for nervous tissue. Means it directly affects the nervous tissue of the human body. Now we can see the pathophysiology of the virus. Virus enter in the bloodstream and crosses the blood-brain barrier. The barrier between the vessels of the blood and the brain, the barrier that is called the blood-brain barrier, which is present over the skull and below the head and above the skull. Between that, this barrier will there. Now, the second is the causes vasculitis, means the inflammation of blood vessel, which is leading to the microinfections in the brain, which result the encephalitis, means the inflammation of the brain, and also it will affect the spinal cord. By this virus, this much affection will occur or inflammation may occur in the brain. It may also impact the neuromuscular junction, leading to the muscular weakness or paralysis. Patient may also, or the person who is affected from the Nipah virus may also get the paralysis and the muscle weakness. Now we can see the central nervous system manifestation. The first point is the acute encephalitis with inflammation, edema, and necrosis of brain tissue. Necrosis of brain tissue means the shortening or the damaging or the dying of the brain tissue. The seizure will occur to the person. Seizure means the contraction of the body movement and we can say that sudden contraction of the body will occur. The cerebral involvement causing ataxia means the loss of coordination will occur to the patient. Patient is not able to walk properly or not proper, and also patient is not able to stand properly. It will alter the consciousness and also person may go to the coma by this virus. Also. Cranial nerve palsy in some cases, cranial nerve palsy will also occur. Now we can see the neuromuscular complications. The first one is the flaccid paralysis. Second is the muscle jerk. Third one is the muscle wasting due to the prolonged ICU staying. Means the patient who is staying for the prolonged period of the time in the ICU, the person you will get muscle retardation, or we can say that the muscle becomes stiff for that particular area or particular person. The fourth one is the polyneuropathy, especially in critical ill patients. This condition will occur. Now we can see the clinical symptoms of the Nipah virus. In the initial phase, the symptoms is like the fever, headache, and the muscle pain and the sore throat. The common symptoms is the common cold. That type of symptoms will occur in Nipah virus in starting phase, initial phase. Then the neurological symptoms occurs in some after sometimes the neurological symptom may also start in which the seizure will start, loss of consciousness will occur, encephalitis will occur in some time like 24 to 48 hours means in between 1 to 2 days, and even if it is not treated, then the person may also go in coma within 2 to 3 days in severe cases, not in regular cases. Now we can see what is the role of physiotherapy in the Nipah virus. So in Nipah virus, in the initial phase or in the acute phase, in ICU ward, the person may the range, but the person in the ICU gets the less range of motion due to the long period of staying in the ICU or the staying in the same position, single position for a prolonged period of time. So the passive range of motion, which will prevent the contracture of the patient muscles of the patient, because the patient is lying in the supine position for a prolonged period of the time. So the range of motion of the person is so decreased. Positioning to avoid bed soreness. We can use the physiotherapy or we can use the passive range of motion for the avoiding of bed soreness to the patient. Chest physiotherapy. If the infection will occurs in the lungs, then chest physiotherapy will help. Now we can see also in the physiotherapy techniques, there are several types also, or we can say there are several techniques which we will use to prevent the Nipah virus. First one is the neurological rehabilitation. In the neurological rehabilitation for NDT means neurodevelopment technique for motor relearning will we should give. And we have to teach or we have to re-educate the patient for doing the basic things or basic activities. And we have to give the PNF technique. PNF is one type of technique which is useful to gain the normal range of motion, or we can say that patient can able to do the regular daily activities by after giving the PNF technique. Balance training using therapy ball, balance board, because of that, patient is lying in the same position for a prolonged period of time. Patient may lose the balance and coordination. So for increasing that balance, we can use the balance board and therapy ball gait training because of the patient sleeping for a prolonged period of the time in ICU. So gait pattern is also changed. So for gait training, we should use some assistive devices and the coordination technique exercises means we have to give or we have to re-educate the patient daily living things or daily activities. So in that, the second point is musculoskeletal and neuromuscular care. For the neuromuscular care, we have to give the strengthening exercise because the muscles will become weak. In Nipah virus, the muscle become weak, so for that, we have to give the strengthening exercises. Strength exercise to reduce stretching exercise to reduce spasticity or tightness because of the patient sleeping off in prolonged period of time in supine position. So the stiffness or spastic nature will occur of the muscles and the muscle become tight. So for reducing their tightness, we have to give stretching to patient. Myofascial release and soft tissue mobilization. If the patient needs that, then we have to give this myofascial release and mobilization. The third one is the cognitive therapy. In cognitive therapy, the orientation training, memory games, or dual task activities we have to provide to the patient if needed. The common modality which we used for the patient who is affected by Nipah virus is the TENS, electrical stimulation, infrared radiation, hydrotherapy, tilt table or standing frame, mirror therapy, and the game-based therapy. TENS, the transcutaneous electrical nerve stimulation. This modality we can use for the pain relief of the patient. Electrical stimulation we can use to re-educate the muscle and contraction of the paralyzed muscle. Infrared we can use for the muscle relaxation and the circulation movement, or we can have also IR will means infrared radiation will also increase the blood circulation in the patient body. Hydrotherapy also used for muscle relaxation and also it will improve the range of motion of the patient and it will reduce the spasticity. Now, the mirror therapy. Mirror therapy is used for the hemiplegic patient or the motor relearning type of exercise. While for that, mirror therapy will use virtual reality or the gaming-based therapy means the cognitive or motor engagement we can use for this. Thank you. That's all for my side. From my side, I will cover the Nipah virus and what physiotherapy roles in Nipah virus and how Nipah virus will introduce or what is the Nipah virus and how it affects the patient and the symptoms of the Nipah virus I will cover. Thank you. My name is Sanjay Su from second year B Physiotherapy. Thanks a lot.